All right. So, if you know me or any of my content, my name is Evan Strong. I do videos based and geared basically around shoelacing and tying and our clothing and the discrepancies within those things, left and right, forward and back, tags and weights and bulky seams, unevennesses that don't allow our bodies to have their natural center line. And I show little tweaks within those kind of things, how to very easily allow our bodies to do what they would naturally do before we place things upon them that pull them out of their natural alignment. So I usually like to do some kind of demonstration to just show that my body's in pretty darn good alignment. I'm just gonna stay sitting for right now, but yes. I've talked about in my content quite a bit that the jaw stabilizes our bodies a lot. Okay, so when I'm talking about the center line, our nose, our sternum, our spine is the center of our bodies. And our jaw stabilizes us through our entire body, because when you think about balancing, a lot of times it's like, a lot of times we do this kind of thing, like the jaw holds the head in place, and our head has a decent amount of weight to it, and it's on the very top of our body. And if our jaw is misaligned, then it can cause, like this shoulder, for example, if my lower jaw, right, the part that moves, is over to the right just a little bit, and my right shoulder doesn't want to be sitting in its normal, natural, internally rotated spot, because there's muscles that come from the jaw that come down into your neck, through your neck, into your, they attach into your scapula, your shoulder blade, which I always talk about needs to get wrapped around the rib cage to get into internal rotation. They attach into your collarbone, they attach into your ribs and allow for expansion of the rib cage and natural breathing patterns. The jaw plays a role in a lot, especially in the upper body, but even your feet can be affected, even your balance in your lower extremities, because of how it stabilizes your head. So, there's way more to that than I understand, and I could explain more than I did there. The point being, my whole approach and my whole introduction into this journey of getting my own body so much more centered and sharing my information freely, as I've stated before, all stemmed from getting my first pair of barefoot shoes and realizing that we're all just about tying our shoes in the same direction, which is very uneven, which causes an imbalance that travels up our entire bodies. I have my shoelacing and tying technique within where my content's placed in multiple places in there. You can go and find exactly how I show the technique that I've come up with to lace the shoes to allow for natural arches and to tie them in a way that lets us have even internal rotation. The biggest point is you take the outside lace and cross it over the top of the inside when you tie that first knot, right? Even toward the center of our bodies. So yeah, for an actual, how to, there's stuff within my content that'll just allow your shoe to fit like a glove, because everything travels from the bottom up. And this is stuff that I've mentioned in my content many times, because that's the thing, right? Pairing it with taking the tags out of the tongues of your shoes and then everything from there up. Any item of clothing anywhere, remove the tags. And I've gone into depth on why and everything. I could sit here and get into that and talk about that, but the point that this video is about, the reason I'm making this, is I do have to give a little bit of credit. Not that it's their information, but this is where I got the introduction to seeing what's happening within the jaw and the teeth and actually some other things within the body is PRI, Postural Restoration Institute. I didn't ever hear them talk about shoelacing or tying. I never heard them talk about clothing, and those are the two things that are my absolute root. That's where I sit, is within shoelacing and clothing. That is how I've allowed my body to get to where it is. But PRI talks about the same patterning because it's just about a universal in 2024 patterning for the entire population because of the things that I show, our clothing, our shoelaces, and then there's other habitual things within our lives that play into it. But what I'm getting to is last year in 2023, when I was starting my whole understanding of the body, Postural Restoration Institute, there was a guy, I don't know his name, or I really would give him credit because he gave some great information freely, as I do, just true information about what's going on with the body. He talked about how misalignments within our bodies can be in the teeth, okay? Now, from this point forward in this video, I'm gonna talk from my own understanding of it and what I've come to find. Postural Restoration Institute, especially that one guy who, the video I saw, gave me the introduction to thinking about this. But once I started lacing and tying my shoes with my technique that I finally landed upon, and getting what it is my right foot, which is the most common for right-handed people because the way they tie their shoes, that direction, pulling that right side of their entire body, traveling up into a chronic state of external rotation, right? Which again, as I've mentioned, so many things within our clothing play into that exact same patterning. Once I allowed that right foot to have its internal rotation by just tying a knot over to the inside, even, my bite started to change a lot. So this started last year, but it's just, my body's been progressively getting more and more and more even left to right and centered toward my actual center line, as we all have. And I have had a filling fall out. Let me give a little bit more context. About a decade ago, maybe 11 to 13 years ago, because I was around 13 years old. I'm 25 now. I was at a trampoline park, indoor place with a lot of trampolines, doing flips and stuff. I've mentioned before I used to do a lot of parkour, mostly outside. And in this trampoline park, I did a front flip 360, which I could do at the time, but when I came around, I actually think I did it, I jumped off of this platform onto the tramp and then immediately went into the front flip 360, or front full, right? And when I came to land, my feet hit the tramp and bounced up, and my left knee hit this left front tooth hard, boom, and I just laid there on the trampoline oh my goodness, that was an impact. What ended up happening is that tooth, the root of it died because it got hit hard. So, by my knee, right? That's a pretty hard thing to slam into your front tooth. So what happened is I had to go get a root canal on that tooth. And that was a big experience. Dental work, no matter how strong you are emotionally or pain tolerance wise or whatever, dental work's a pretty traumatic thing. There's so many nerves within your mouth, the entire time they're doing it, you have to be sitting with your mouth open, and that's a very unnatural way to be even breathing and to regulate your emotions. You have to breathe well. So it was a very traumatic thing. I was right around 13 years old. I think I was, but 12, 13, I think I was 13. It was a lot to go through, and while I was in the dentist chair, I'm just all right, we got to get out of here. I'm done. I'm just, I was worked up, crying, upset, a lot of stuff just emotionally, You know, even the people I was with, the dynamics of everything, nothing, I didn't feel comfortable. Scary to get a root canal at any age, and I'm just a 13-year-old boy. So when they were finished with the root canal and I was still in the chair, they grind down. If you've ever had any dental work, they'll smooth it out when they're done. Point being, I was trying to get out of the chair. I was just done, not having a good time, and I don't know how much of it was the dentist. I'm not trying to say anyone wasn't doing a good job, but I don't know. I had never been to that dentist. Maybe he didn't do it well, thought he was just about done, but also I was trying to get out, and I'm like, we're done. This is, I just want to go lay down. There's a lot to go through. The point is, there was a lot of excess filling material on the back of my front tooth for years. So for, like I said, somewhere between 10 and 12 years probably, my bite has been so off that none of my teeth have really been touching normal because of that excess filling material there. But I also had dental work back here, like I mentioned, and so my bite was not allowed to sit normal. And because of that, my entire body was out of alignment. I was also, up until last year, 2023, like I've said, tying my shoes unevenly, playing into the same thing. So, as I've talked about, most people are in this patterning that we're getting out of through natural means of just allowing our bodies to be centered through the things that I show. Most people are in this patterning since around 3-4 years old, whenever they start tying shoes. Because unless you're taught to tie your shoes evenly toward the inside, you're going to just do a knot that's natural for you to do on both sides, which is uneven. So I've mentioned how, just insertions of muscles, the ways that joints connect, everything. You can have bone spurs all the way up, everything in your entire body, the way that your organs sit within your body, your breathing patterns, how stretchy, just because skin is naturally stretchy, how much skin there is on each side, all of that after years of your foundation being off by tying your shoes unevenly, all that happens, and it has to have time and the ability just be allowed to correct itself, and it will correct itself as long as there's not something restricting it. Okay, so that's what I do within clothing. But within our mouths, if we have dental work that we have had while we were in this patterning, right? If I'm sitting like this, which is very common, this is possibly exaggerated, but also there's plenty of people who, when you see them, they're almost always that much turned, right? The patterning that I always show. So because of the shoe lacing and tying and the things within clothing that I show how to easily fix freely within my videos. If you're in this position, right, and your lower jaw is already to the right, and you go lay in a dentist chair, probably with your shoes on, tied unevenly, twisting your legs, stemming at the feet, your legs, your femurs, your hips, it'll be a slight forward and a twist, twisting your spine, twisting your shoulders, twisting your neck, and you're laying in the dentist chair with your shoes tied. Even if not, your body internally is ingrained in a patterning, and you get dental work done in this kind of uneven jaw toward the right position, then once you step out of that dental chair, that's reinforcing that ingrained unevenness. And like I said, your jaw stabilizes your entire body. So now it's trying to stabilize from a place of being uneven that it can't get to a center if there is man-made material, whatever the filling material is. Sometimes it's that white composite-y stuff, sometimes it's actual metal. Whatever it is, it's a man-made something in your mouth that is a foreign subject too, that your body can't correct. Your body can correct itself, and it does that very, very well. If you had never had dental work and you are in this patterning, still the same chronic patterning, but there's nothing within your actual mouth where your bite sits to hold you there. Once you start tying your shoes evenly, and once you take out the things, tags within clothing and uneven seams that are playing into the same patterning, your body will correct itself as long as there's nothing else restricting it, like within here. But as I mentioned toward the start of this video, I've had a filling fallout over here, and that excess filling material on my front left tooth that I got the root canal on has now, within just the past few months, been allowed to wear down, because once I got the foundation of my body to be just allowed to be centered, as I say, my shoelacing and tying technique does not pull or push your feet or ankles in any way. It allows them to fit like a glove. When you place your shoes on, it allows it to be the shape of your foot as closely as we can get within placing a shoe on our foot. So it just allows, and has allowed within this past while that I've been doing this, close to a year, my feet to just be even. And that allows every muscle traveling up and every joint, like the knee joint being in a chronic state of a little bit of a twist, to just be naturally straight, and everything to adjust to its natural position. And within that, your jaw follows. So now chewing with a bite that was meshing well within a very imbalanced body, right? Once the body, like this shoulder, which is very common within this patterning, will come back and in, as I've shown many times, right? This side of the rib cage on the right, I haven't really mentioned this in my content, but most people can't breathe within this same right-handed type of patterning. They can't breathe with their right rib cage, and that's, with your right arms here, you have to get your scapula out of the way, as I've mentioned, to fully expand in ideally 360 degrees. So all these things are being allowed to happen over here, and it pushes your jaw. It doesn't actually push it, but it allows it to go back into its center from being so out of alignment. So then when you're chewing your food, or even just not clenching your jaw, but your teeth sit together, right? When that's happening, it's allowing your teeth go into your jaw through the root of the tooth, right? And it's allowing everything to just adjust all the way around your entire bite to a center where it would naturally be before things like this, right? These specific things, the shoe tying uneven, also the arch is being pressed down through improper lacing, will push your jaw forward a lot. If your jaw comes forward, your shoulders follow, right? Your arches open up, your jaw can tuck, your neck tension goes away, your shoulders go back to their natural internal rotation. So dental work plays into your body's mechanics big time. And as I mentioned within my content, I try not to talk about anything that I don't know well. And this is personal experience that I'm speaking from. So I mentioned PRI, Postural Restoration Institute, because my filling hadn't fallen out last year, 2023, when I watched his video. And my bite was still in a very chronically imbalanced position, playing into the patterning. But what I have personally done, I have been to 0 doctors. I have done 0 exercises. I've mentioned all I've done is just massaging out stuck muscles with my own hands. I've done 0 exercises, routines. I have seen no specialists, no doctors. And my body, if you have context, if you've seen videos of me or photos of me even last year, my body is entirely different because of lacing and tying my shoes with the technique that I have found through a lot of trial and error, and the things that I show within clothing to tweak freely within my content. So, yes, dental work is hugely a part of our posture, and the reason why we are in the posture position that we are in. And I don't like the word posture necessarily, because a lot of times when people hear posture, they think that it's a conscious standing straight. And that is terrible. I have mentioned so often within my content, if anybody ever gives advice for somebody to consciously do something with their body, sit or stand in a certain position, that is absolute absurd advice, because you cannot for more than a few seconds before you just forget, or before you get fatigued by trying to force your body to do something that it just should naturally do and would, until these things happen that I mentioned. So, the point being, once you start tying your shoes evenly, lacing them with my technique, once you start wearing clothing that fits on the shoulders, on the waist, removing all the tags from everything, and doing the things that I show that are so simple, your body will just start to be in its natural alignment because it's just being allowed to. Okay? This sounds familiar if you've heard my content. But if you start to have pain in places, in the jaw, in the neck, in any area of your body, realize that your body has been in a chronic bad positioning. That is the key word, bad. Okay? And we want it to get just into its natural center. So when it's allowed to just be normal, there's actually a lot of adjustment that has to happen from being forced to be unnatural for so many years. Okay? I'm only 25 years old, but as I've mentioned, it's been at least 2 decades that I've tied my shoes. Right? I mean, I was probably tying shoes by the time I was 5 years old, and almost guaranteed I was always doing it the same direction. So every muscle and joint, bone, ligament, tendon within your entire body, as I mentioned, everything internal that we don't think about, the places that our organs sit, and our, mile-long intestine, there's so much in there. There's so much within the body. And going from being a 5-year-old human, 3 feet tall or whatever, 3.5, 4 feet tall, whatever, to now I am 6 foot 2 inches, growing within being pulled in an unnatural, uneven pattern through shoelaces, and also everything within clothing that plays into the exact same thing. Your entire body is growing unevenly. The beautiful thing about the human body is it is so amazing at adapting, and it will correct itself if it's allowed to. But things that are placed in it, artificial, as is teeth filling from cavities, from, in this case of my front left tooth, a root canal. Anytime there's any kind of dental work done, it's an artificial, man-made thing placed within your body. And your body can adjust for itself, but it cannot adjust for a foreign object within it. It will try its best, but that is why I mentioned my filling falling out and this being worn down through chewing. So, yes, dental work plays a huge role into your body's natural function. Nothing to fear, nothing to worry about, but I will mention, I've seen it very commonly, even within my own family, for people to have permanent retainers on their bottom teeth. Maybe they also do it on the top for some people, but within my own personal family, I've seen there's a metal band behind people's bottom front teeth, like 4 to 6 teeth. Your teeth are individual and your jaw adjusts. And if you glue teeth together with a metal strip, you can't naturally adjust the way that your body would do, because there's something inhibiting that from happening. Also, your tongue, there's a lot of people in different places, either posture type places or vocal coaches for singers or whatever. They'll talk about tongue placement and just a natural tongue placement, not something that you're conscious of, but just where your tongue would be, as I mentioned within my content, before our bodies get out of alignment. And there's a natural, slight suction of the tongue on the roof of your mouth, because your tongue should sit pretty well evenly within your mouth, within your teeth. And it will do that naturally, but through this patterning that we are almost all in until we fix it. Allow it to be fixed by just centering our clothing, right? Your tongue will sit unevenly and press your teeth into an unnatural position, right? People will be like, I've shown this so much. Again, if you have past context photos or videos of me, if you've seen those before, like last year, well, really before, a ways into that, because my patternings were being corrected, right? And it took a little while to notice a difference. But I used to smile like this. I'd be so far forward on the right, and I'd smile, my right eye would be squinted. And now, again, I'm still working through patterning, but I'm just so much more in alignment. So, yeah. There's nothing wrong with having dental work done. In your own situation, it happens for the reason it happens. I've had it done. The reason I'm talking about how it can be such a problem is to shine light on the truth of the jaw stabilizing the entire body, and again, personal experience. After I had heard Postural Restoration Institute talking about it, it happened to me. My filling fell out, so, which is a good thing, because now my body's allowed to be in alignment. If it needs to be fixed, it will now be fixed in a center, right? And then there's no need for it to have to adjust, because it's in a good position when it's placed in there. But I really wasn't when I had it done, because of these things. So, yeah, there's a lot that happens within dental work. People get implants, people get crowns, people, like I said, get multiple teeth fixed together. What I was saying with where the tongue sits is, if you have a permanent retainer behind your teeth, between the rear of your teeth, like your front teeth, and your tongue should sit in there very naturally. And if you place something in there that's causing a gap, what I'm going to do right now, I'm going to kind of exaggerate it, but I'm going to pull my tongue back from where it would naturally sit and watch what my body does. Okay, my tongue's here, naturally sitting right at the rear of my front teeth, just in a natural position to allow because that slight suction of the tongue that I was talking about actually really activates your core also, because it stabilizes everything, as well as just a good bite with the actual teeth hitting together. So, well, meshing together is a better word. When you have something there, pulling my tongue back is essentially showing that gap that that permanent retainer is causing. And I'll show it again, right? I'll kind of say pulling it back and then putting it normal. Like, it's back right there, and now it's normal, right? I mean, I can move, but if my tongue has to be retracted, because that's really what you're doing, you have to almost consciously retract your own tongue because there's something in the way. And so you can't quite bend your neck down, right? Like, you'll get tension back here. Your shoulders can't get to where I'm always showing internal rotation, right? Which is so much farther of a reach than a lot of people are used to, including myself for so long. So there's a lot going on within the mouth that plays into our actual mechanics of our rotations within our shoulders, our hips, our knees, our neck, our head, our breathing patterns, everything that I always discuss. It's just very important to mention, and again, out of personal experience of my own, what dental work can do. Okay, my name is Evan Strong, as I mentioned at the beginning, and I make videos like this, normally geared around clothing and shoelaces and how they affect the things that I've mentioned within this video. So I am going to be designing clothing with the sole function of just allowing our bodies to just have their natural ranges of motion and their natural rotations, and just make clothing that does not force us to get sore, because that's what most clothing does until we at least do the modifications that I show freely within my content here. So I've got a big journey ahead of me, and I'm going to be sharing a lot of it as I go. So if you like content like this, if you want free information on how to let your body just naturally do what it would do, I've posted a lot of videos already. You can go back through and look. There will probably be more to come. I don't have any plans necessarily. I just post what I feel that I need to on the day that I feel that I need to. So stick around. It's very, very easy to get our bodies back to center because they want to do it on their own before we force them into an unnatural pattern. Okay, thank you. Watch more of my content if you like it, and I'm gonna try to get to the camera after being in that position for that long. My knees are a little bit stiff after sitting crossed like that. Okay, thank you.